My name is Dr. Nadia Yousri. I'm a triple qualified OB&GY surgeon and a fellow of the Royal College of Obstetrician Gynecologists and aesthetic gynecology and sexual medicine and cosmetic specialist. The most important thing, I'm obstetrician and gynecologist, and I worked in more than 22 years in NHS hospitals, and recently joined the private sector in a clinic in Harley Street to add to my practice and widen my practice to add the aesthetic gynecology procedures. Yes, aesthetic gynecology is a new medical subspecialty, that I really like it so much because it applies natural, non-invasive procedure to instigate rejuvenation. So getting more blood flow to the area wherever injected and laying down new tissues by stimulating the builder cells like fibroblasts and stem cells. So with this principle, we can inject everywhere using the patient's own blood, injected, for example, into the hair, face, and the lady's breast, what we call vampire breast lift, the intimate area of women and men to treat what we call sexual dysfunction. So for the ladies, we inject O-shot, for example, which is plasma-rich plasma injected in the certain points in the intimate area, and in the gentlemen, what we call P-shot. And also I do shockwaves to treat erectile dysfunction. So these are very important because they have got good success rate, and they appear like a very good option where other methods fail, or other traditional methods fail. So it's just short of surgery. So it's really good thing because they are successful. If you have good expert to do them, case selection properly after assessment and counseling, you can achieve very good results. And it's not aesthetic gynecology. The word is misnomer because they think it's beautification. Aesthetic gynecology is coming from the word aesthesia. Anesthesia means like aesthesia-like sensation. So it's the returning of sensation. So basically returning the function, that's what we do. Correct dysfunction and return the function, and as well appearance, it's a bonus. So it's the word, the proper thing or the terminology is regenerative gynecology and andrology, because, and I was the first one to say that in public, and all after that they started to follow that because it's the principle of regeneration, not beautification. So that's why it should be done by specialists and experts in medical area and medical expert in this area. First of all, I pride myself that I have been in the top 3% of feedback, patients' feedback, brilliant result actually on the national level. Because actually they send me feedbacks without even asking. They value about me that they can sense good knowledge, and I'm always keep updating myself and keep my knowledge and updating my skills and develop every aspect of my clinical practice. And I'm honest. I'm very thorough in examination, and you know the patients can sense that, can sense which doctor is better than the other in this. And I'm very caring, so I put them on the center of my care, and I also put my plan of care around them, not the vice versa, and include them in the counseling and the discussion and the decision of the treatment. So that's one thing I do, and I tell them exactly the success rate. So it's them that they are important to me. For me, yes, I'm happy. That's why I'm broadening my experience and the practice to add the non-surgical, to give them more options to choose. Because as I said, it was limited on the traditional gynecology, but non-surgical added to them. So that's for their benefit. So that's why, because I do care about them. And it's a problem, it's really common problem among ladies, yes. So if you give them more options, that's what my duty is to be. The challenge is first of all, I need to, as an obstetrician gynecologist, to raise the awareness, because that's my duty as a doctor in this subspecialty. Because aesthetic gynecology, Heather, is not aesthetic, it's a wrong name. Aesthetic comes from anesthesia, which is the sensation, loss of sensation, trying to get the sensation back. So they thought aesthetic is like beautification. No, it's not beautification. And aesthetic gynecology procedure are not meant for beautification like no, they meant to regain function. That's most important thing. So aesthetic gynecology is a misnomer. The public wrongly just got this impression. It's better to say regenerative gynecology, which I'm the first gynecologist to use that term, and later on everybody takes that. So it's a regeneration process, getting the principle of regeneration to work in this area. So also the challenge is that this is a medical subspecialty, not for everyone to do it. It's better to be done by specialist doctor who knows, because it's a microanatomy, microphysiology, and it's not the area, it's the whole person, the whole lady. And a case of selection is very important to decide the success rate and counseling and the side effects, and is it suitable for her or not. So these are the challenges I'm trying to get onto the public about that. Also managing the idea about the ladies, they come with either ideas that it wouldn't work or they expect too much. So with after assessment and history taking, of course, and doing the screening test that it should be, then we can talk about the honesty, how successful and how much the care plan for them.